from the Infirmary Report. Today, guys, we're discussing Mark Teixeira of the New York Yankees, who has suffered a significant knee injury. We're going to bring in the fantasy doctor, Dr. Selene Parekh, who's going to give you some clarity on that injury and discuss his expectations for Teixeira going forward. Doctor?
This is Dr. Selene Parekh, the fantasy doctor. Yankees' Mark Teixeira had an MRI yesterday, and it showed that in his knee he has articular cartilage damage. Now, that is a big bucket term, and what it actually means is a little bit hard to understand. But in the knee itself, we have a couple of areas of cartilage. One of the more common areas is known as the meniscus. There are cartilage discs that sit within the knee that prevent the shin bone from hitting the thigh bone. The meniscus is what is more typically torn, and that typically, if it's big enough and causes a lot of pain, can be treated with surgery where you go in, you shave it down, and athletes are back on the field within 4 to 6 weeks. Well, for Mark Teixeira, it seems like he is having more of an articular cartilage issue. If you look at the articular cartilage, it actually drapes or covers the surface of the bone so that the bones aren't rubbing on each other, but rather the cartilage is rubbing against each other. Now, depending on the location, the size, and the pain that Mark is having, he may or may not need surgery for this. Just taking rest and letting it quiet down typically doesn't do the job. So you may see that he gets a steroid injection. He may get PRP injections or even stem cell injections. But if all of this fails and he continues to have pain, do not be surprised if he has surgery to try to clean this up, to try to do what's called microfracture surgery, where they drill holes into the base of this little cartilage area that's torn. And if that happens, he's out for about 3 months, maybe the entire season. So we'll have to see how this plays out. Again, right now he's on the 15-day DL list. But this is a work-in-progress situation and may change within the next few weeks. This is Dr. Selene Parekh, the Fantasy Doctor.
We'd like to thank each and every one of you who have subscribed to the channel. If you enjoy the content we're making at the Infirmary Report, please slap a like on this video, and we'll see you next time.